Hello, today we are going to discuss on the congenital malformations of female genital organs. Myself Dr. Humaira Tamkanatruhi, Professor in HOD Department of Prasuti Tantra and Stri Roga. So let's start. Here, coming to the introduction. From the embryological consideration, the following factors can be reduced, like the developmental anomalies of the external genitalia, along with the ambiguity of the sex, are usually genetic in origin. So, whenever there is a problem with the genetics, then only there will be problem with the external genitalia or ambiguity of the sex, where you are unable to differentiate between the male genital organs and the female genital organs. Okay, so here next point is the major anatomical defects of the genital tract are usually associated with the urinary tract anomalies 40%, skeletal malformations 12%, and normal gonadal function. So here the gonadal functions, that is the ovarian function, will be normal, but there is only anatomical defect seen in the genital tract as well as the urinary tract. Sometimes the skeletal malformations will be seen, and the minor anomalies escape the attentions. It is moderate and severe form, which will produce the gynecological and obstetric problems. So coming to first, the developmental anomalies of the external genitalia. Here the two entities are there. One is the perineal or the vestibular anus. Second is the ectopic ureter. So for one by one we will see it. First is the perineal or the vestibular anus. It is detected at the time of birth. Usual anal opening side is evidenced by the anal pit. So instead of anal opening, you are just going to see a anal pit. So where the anal opening is situated, it is situated inside the vestibule or sometimes close to the posterior end of the vestibule. So, and that condition is called as vestibular anus. Sometimes an anal opening is seen inside the vaginal canal, and in that condition it forms an abnormal tract called as the rectovaginal fistula, as it is seen by the births, hence the name congenital rectovaginal fistula. Opening is usually sufficiently big. Further reproduction is not a problem, but it is better to go for cesarean section in the future. Next is the ectopic ureters. As you know, the ureters are the tubes connecting the kidney and the urinary bladder. So it carries the urine from the kidney and it opens into the urinary bladder. So in the ectopic ureter, what happens? The additional ureters is starting from the kidney and it is not opening inside the bladder, rather than it is opening in the vestibule close to the urethra or in the vagina. So the main symptom is here is uncontrollable wetness. There will be leakage, and as it is not having the inspectors like that of urethra, so hence the urine leaks out and patient complains of the wetness which is not controllable. So coming to its treatment, here three types of treatments are there. They are all surgical treatments. One is a partial nephrectomy. You can remove the part of the kidney along with the ureter, and second is the ureterectomy. You can only remove the ureter, or sometimes you can implant the ectopic ureter into the bladder. So these are the things you can do for this correction of the ectopic ureter. So this is all about the external genitalia anomalies in the female. Thank you.